for HCPs, it's important to stay connected to the communities that you serve, right? And to understand not just the person sitting across from you or the person that's on the bed or the person that's on the examination table, but to really understand what else is happening in their life. You're more than just a diagnosis. So it's important for HCPs to really make the connection, because the gap is that we don't have time to do so. That doesn't serve or help us deliver excellent healthcare when that's missing. So,
welcome, MedTech Gurus. Today we're joined by Stephanie Hunter Banks, a leader in medical education and patient engagement in the rare disease space. Stephanie serves in U.S. medical learning and development at Jazz Pharmaceuticals, where she focuses on helping healthcare professionals better understand the patient journey and how thoughtful engagement can improve outcomes. What makes Stephanie's perspective especially powerful is that her work is not purely academic or professional, it is deeply personal. Stephanie is also a rare disease patient herself. That lived experience gives her a unique lens into the long and often frustrating journey many patients face before receiving answers. Through her work, Stephanie advocates for a deeper understanding of the lived experience of rare disease patients and the importance of building authentic partnerships between clinicians, healthcare organizations, and the communities they serve. In addition to her work in industry, Stephanie is also the founder of Hunter B Consulting Group, where she coaches leaders and organizations on resilience, authenticity, and discovering what's possible when growth becomes personal. Stephanie brings a powerful blend of personal experience, professional insight, and leadership coaching that is helping shape how rare disease care is understood and delivered. Hey, Stephanie, are you ready to be our guru today?
yes, Tom, super excited. Thank you so much. Wow, that was awesome.
Yeah, we're real excited to have you. So let's start out and just tell us something fun or interesting about yourself or your family so we can get to know you a little better.
Yeah, so I am a proud mom of two children. One is a graduate of Temple University. The other one is a freshman at UNC Charlotte. And I recently learned that I'm probably a multi-potentialite, which is basically a person that has diverse interests and skills. I'm not necessarily leaning into only one thing. And I think that's probably true for most people in terms of how you view the world and what you engage in. And I think something that's super interesting is that from the time I was 5, I've been performing and singing. And at one point, I wanted to be an actress. Actually, that's exactly what I wanted to be. My mom, I had a whole plan to go to pharmacy school and then go to New York and do auditions and work part-time as a pharmacist. But I never did that part. But I've performed in community theater and performed for live audiences. And I'm excited about perhaps maybe reigniting that passion later on in life. So
I love it. I love it. I play around on the guitar a little bit. We'll have to do an offline jam session one day.
Oh, I would love that. Love it.
That's great. So, Stephanie, you indicated that your role is all enabling medical care professionals to have better scientific engagement. So many of our gurus out there are at early stages of innovation. So can you share with us why this is so important and how it helps make an impact on the patients they serve?
Yeah, I think one of the most important things you can do in our line of work in healthcare, which is a sensitive area. I always used to say when I'm precepting students, like, we are dealing with people that are sick, meaning that they might have symptoms. And so the importance of really having empathy and connection and patient engagement and HCP engagement is like top of mind. For HCPs specifically, or healthcare professionals, we develop medicines and therapies, and the doctors, the pharmacists, the nurses, they all go through continuing education, but clearly they can't keep up with all the new things that are happening. And so in medical affairs, our role really is to translate the complex scientific concepts and data points into real world clinical applications, so that as clinicians are making decisions with and for their patients, that they're using all the evidence possible to be informed about what the best approach should be. So having, great scientific exchange leads to all kinds of new things, new hypotheses, new research venue or ventures, new understanding in terms of safety profiles. And so it's just super important, that scientific engagement and patient engagement go hand in hand, and that we really are thinking it, are not losing our why, which is, really helping to change lives.
Yeah, I love that, right? As a veteran of many years in this business myself, right, I always consider it a privilege and always try to think about the patients that my customers are serving. Is
Mhm.
that how you feel?
Yes. I think we have a sort of, for lack of a better word, a sacred responsibility to honor that relationship, because a lot of times we're meeting people at one of their most vulnerable times in
Mhm.
life. And so if you are, working in an industry that really, for the most part, we have profit models that say we are essentially profiting off of the sort of illness of someone else. I think it's important to keep at the heart why we, investigate and research new diseases and really try to change lives. That's essentially the crux of it. We're trying to alleviate suffering and change lives, and in doing so, we just have to be, you know, we have to really approach that with care.
Mhm.
Um, and one way, the way we honor that is to, build trustworthiness, making sure that we're doing everything in an ethical and responsible manner, that we're being, thoughtful around how we engage and how we bring people to those therapies and how we support them too, right? Like there's lots of folks that get on therapies and sometimes, I say, sometimes the treatment is just a treatment. It doesn't erase some of the other things that might be happening. And sometimes your symptoms don't go from 100 to zero. You're still living with a disease. So I think it's just important for us to keep that in mind as we're doing this work.
Yeah, yeah, that's I find that really fascinating, and to build on that a second, right? I'm very intrigued with your specialization in rare disease, right? And rare disease patients often spend years searching for answers. So, from your perspective, what does that diagnostic journey really look like for the patients and their families? Can you provide us some insights there?
Absolutely. I'm a living, breathing example of what it's like to go from what I call able to differently abled. I've actually not been diagnosed. I'm still on my rare disease journey after 22 years of noticing initial symptoms of foot drop and muscle weakness. My technical diagnosis in my chart is muscular dystrophy NOS, or not otherwise specified, because it can't be linked to any specific gene at this moment. And so for me, that journey, and I would think that for most rare patients, right, these are small communities. And sometimes, for doctors that are really supporting these patients, they're looking for needles in a haystack. For the patient, it's like a roller coaster. And I don't like roller coasters. So I can't even recall the last time I've been on one. Because of that feeling of up and down and, quick turns and all of that. Some of it's, the design of a roller coaster is super unpredictable. It's designed that way for the thrill of it. When you're a rare patient, however, you don't really feel thrills and the twists and turns of the journey. You feel highs and lows. You feel energized. At some points, I'm a pharmacist by training. So, and I'm also trained in drug information, which is the specialty in pharmacy that is trained to really evaluate and look at the literature in a non-biased way. So, sometimes I would go on deep literature searches and reading everything I could to try to uncover for myself or bring questions to my clinician. I would bring articles. And then sometimes I would just say, you know what? I'm just going to live my life. And then I get a spark and it start again. And so for me and for a lot of rare disease communities, it can feel isolating sometimes, because it's not like you go to the doctor, you have elevated blood pressure, they diagnose you with hypertension, you're on a medicine that can treat it, right? It's a whole long journey to a potential diagnosis. It's not always going to be end in an actual diagnosis. And sometimes, even if there is a diagnosis, right, there oftentimes isn't a treatment because, you know, rare diseases, you have to when you study them, you have to actually find the patient populations that, that you need to study. And that in itself is difficult. So the whole journey for patients in our communities can be quite frustrating. But I think the thing that resonates with me is that, the communities are strong. It's not just about the patients or families or caregivers. It's also about the doctors, the nurses, the friends, the spiritual advisors, all the people that are in community with you that help you to sort of navigate the journey, which sort of alleviates some of the stress and pain that you might feel. Um, but it can be daunting, right, to go through this. And I think, the approach that I typically take, and that's why I speak a lot about resilience, because I've done lots of reflection on sort of what makes me me and why I keep pushing forward when some days I just do not feel like it. And I think for me, it's just because why not? Right. For
Hmm.
me, it's about what I can do. And I love um, I'm launching a blog called Discovering Possible. And the whole premise of that is to really, explore. It's about finding out what you're capable of and not sort of resting on what your diagnosis is, because a diagnosis is a diagnosis, but it's not the end of the world.
Yeah,
So,
yeah, yeah. That's really helpful. And as you were talking there, I was thinking about the research I did for this episode, and you've often spoken about the agony of defeat. If I've got that right. When
yeah.
tests come back inconclusive, or when a diagnosis remains out of reach. So, building on that a little bit, how do patients and families build resilience during this time of maybe often long periods of uncertainty? Can you help us out with that?
Yeah, I think for most families and patients, they, anchor to, what gives them joy,
Hmm.
anchored to hope, because there always is hope. We have so many advancements in medicine today that even, for example, a breast cancer diagnosis, which 25, 30 years ago could have been fatal, there's so many people that are surviving and even thriving after that diagnosis, that you only need to look to adjacent therapeutic areas or maybe in your own community to get inspiration. And so I think the defeat part is where you have some great hopes, right? Like I went to Mayo Clinic, and on the recommendation of my doctor, I called and said, "Hey, I have a really tough case. I'd love for you to explore my case." And they have this Center for Individualized Medicine that studies rare disease cases, and they have about hundreds of them per year. They call them diagnostic odyssey. So just imagine, like when I called, I mean, it was a moment of pure weakness. I mean, I was crying. There was a whole episode related to that. Um, and when I called, the lady on the other line was so patient and she was so caring.
Hmm.
And when I went there, right, I went to Rochester, Minnesota. I went for an entire week. I saw specialists all the way from cardiology, immunology, rheumatology, all the ologies. I had it covered. I had MRIs, CT scans, chest x-rays, blood draws. And in my head, I thought, this is it, right? This is probably about 10, 15 years into my journey. And I thought, this is it. I'm going to have an actual diagnosis. And I walked away with nothing. And I felt like, wow, like I gave a whole week of my time. I was poked and prodded almost like a specimen in a lab. And then immediately I said, but then what was the benefit of that experience, right? Maybe there were physicians or folks that I interacted with who now think about me as a case, and it's top of mind, so that if they see those constellation of symptoms again, or they hear a similar clinical presentation, they might go, oh God, I remember Stephanie, and now
Hmm.
we have something we can do about it, let me call her, right?
Yeah,
I'm hoping.
yeah.
But the way you get through that and build resilience is through reflection. I think it's important not to shy away from the feeling of failure, the feeling of defeat, because you really are in a battle to for knowledge, for awareness, for information, to uncover things, for potential treatment. And so it's important to sort of anchor in those scenarios to the true emotions that you feel in that moment. And then what I do is, I speak about it a lot. I've been writing about it a lot, right? I anchor in, the cognitive shift of what is possible, what is positive, because in my, experience, wallowing in the sorrow of it all is not productive. And, there's a power that comes from taking your mindset back, right?
Mhm.
And making sure that you can control what you can control. And there are certain things you can control your mindset. You can control knowing that you also can do tough, hard things. So that experience, resilience plays a key role in trying again, right? That whole if first you don't succeed, try again. That's literally how we have innovation happen.
Mhm.
So I think that even though, there are failures, there are failed experiments, there are failed attempts at making a diagnosis, I owe it to myself to continue going. And that's what keeps me going. Yeah.
Yeah, I love that tie with innovation, right? Because it's never a pure linear process, right? It's messy.
Absolutely.
There's bumps and hills and valleys through all that, and I like how you brought that together because that's truly it sounds like what that's part of the journey, right?
Yeah. It's learning,
Mhm.
at my core, I'm a growth enthusiast, I'm a
Mhm.
learning enthusiast. And so I believe that mindset, that approach to life, just in general, credit to my mom, because when I was little, she sort of instilled in me that can't wasn't a word that we could use in the household. It was a curse word. I actually talk about it in my TED talk about how that one thing almost sort of shaped who I am. Even my kids, they go, "Mom, you don't really accept no, do you?" I was like, "No, I'm not."
Yeah.
Like, what? No means there's a new opportunity for me to figure out, right? So I think as long as innovation, learning, and resilience are all linked, right? It's a whole circle, a cycle of growth and iteration that we as humans too can be on. So, and that's how I see myself as a rare disease patient. Yeah.
Yeah. So, Stephanie, earlier you had mentioned we discussed or touched on patient engagement. So, I know you've led initiatives focused on medical affairs, learning, and patient engagement. So,
Mhm.
help us out with what are some of the biggest gaps you see in how healthcare professionals understand the lived experience of rare disease patients? Do you have any guidance for us there?
Yeah, I think actually, I think the rare communities are pretty tight knit. I think the HCPs that are partnering with patients to really help them on their rare disease journey are pretty locked in terms of the understanding their why. People that do this work, they have to be in it. They experience the same highs and lows almost as the patients because they're in it to help them. What I will say though, in general medicine, there's increasing pressure on physicians. It's not the same type of medicine that, was practiced 20, 30, 40 years ago, right? And so I think one of the challenges is to ensure that you have meaningful connections, that you really take on empathy versus sympathy. Sympathy says I can understand. If I describe something to you, you might say, "Oh yeah, I understand that," right? Or I can understand your pain. Sympathy says like I feel you. I see myself in you. I can imagine what that's like. And I think as healthcare providers, that approach, right? There's a potential for that gap because of the number of patients you're seeing, right? A lot of times patients, physicians are not in solo practices anymore. They're part of large corporations. They're, getting rated on their customer experience scores and all sorts of things, right? And so I think centering to the empathy of it all when you're dealing with patients is key, because the gap there and the risk there if we don't is that we don't build trustful relationships, which means people aren't forthright and open about what's happening in their lives. It's a challenge perhaps to get to a way to support and help them. So for HCPs, it's important to stay connected to the communities that you serve, right? And to
Mhm.
understand not just the person sitting across from you or the person that's on the bed or the person that's on the examination table, but to really understand what else is happening in their life. You're more than just a diagnosis. So it's important for HCPs to really make the connection, um, because the gap is that we don't have time to do so, or we don't make time to do so is another
Mhm.
way to look at it.
Right.
And that doesn't serve or help us deliver excellent healthcare when that is missing. So for me and for the community, it really is about staying engaged with the communities we serve, having that empathy, being able to see yourself in their own lived experience, and then really be curious and inquisitive about their life, so that you can help them solve. And sometimes it's not just about solving for the medical issue. Sometimes it's solving for other things that people need support with. And I think that in healthcare, we don't just look at physical health. There's a comprehensive wellness approach to health that's probably also missing, that I think is a huge gap that we probably can get better at just as a society.
Yeah, so let's explore that for a second, right? Because when I hear healthcare organizations talk about patient centricity, right, it's can feel like a buzzword sometimes. So I'm curious, from your perspective, what does a true partnership with patients actually look like in practice? Can you help us out with that?
Yeah, I think of performative empathy, right?
Mhm.
Where we just use the word. But real empathy says, if you work for Grady Healthcare System, which is in downtown Atlanta, it is a level one trauma center. And there are lots of people that come there in the surrounding communities with, significant wounds. If you're the organization that's in that community and you're not, supporting community engagement events, if you're not supporting community wellness events, if you're not out speaking to people in the community about better health, better relationships, then to me, you're not the best partner, right? You're just there performing a service. A partnership implies that there's a two-way situation, a two-way agreement. So the way I see it, healthcare organizations and healthcare providers can, demonstrate their commitment and partnership to those communities by actually being in the community, right? And I know a lot of times, if you go to medical school, right, a lot of times people go, well, I'm in med school. I think, again, that's a profession that I think has a higher calling for folks that go into that field. They don't spend years and years of study just to go to work 9 to 5 and go home. Most of those
Mhm.
people are super passionate and they're super caring about their patient community. So it shows up in terms of how you support those that you care for and the communities that they live in. So, good partnership to me means that we are inviting those people to be a part of the solution. We're inviting the folks in the community to co-architect and co-create with us. We want to seek to understand first, because that's also a huge potential gap, right? If we're not seeking to understand, then everything else in between is bias and judgment and all the things that lead to bad decisions, essentially, right? But seeking to understand and being in partnership with communities means that you have a really good understanding of what that experience is like, what all the other sort of societal impacts might be, or their family life, or all the other things, right? And you figure out ways to support them in that. And that's what good partnership is. It's not just walking the what is it, talking the talk. It's actually walking the walk. Yeah.
Yeah. Yeah, I love that. So I'd like to shift a little bit to leadership now, right? In addition to your industry work, you founded Hunter B Consulting Group, where you coach leaders and organizations. So, what inspired you to take this step into leadership coaching? Can you help us out with that?
Yeah, Tom, I was reflecting on my leadership journey, and I have a clear memory of when I realized that other people saw me as a leader, because I didn't necessarily see myself as one. I just showed up and I was me, for lack of a better word, right? Um, but I remember I was working at an organization and it felt like I needed to put an office hours outside my door, because people would come to my office and say, hey, do you have a minute? I'd like to run something by you. Or, hey, do you have a minute? I love your counsel. Or, hey, do you have a minute? Can I get some advice? And I remember talking to one of the colleagues, and I was like, why are all these people coming to me for, advice and this and that. And I did have a title that was a leadership title, but in my head, I was just Stephanie, right? And she said, because you're a leader, Stephanie, people trust you. And I was like, I'm a leader, right? So I think that was the first time I recognized the influence and power of leadership to shape and inform, and really help other people live the careers and achieve the things that they want to achieve. So I think leaders have a great responsibility to, and I approach, people say servant leader. I approach my leadership style in that way because I believe that as leaders, we are here to serve at the pleasure of the people that are on our team or around us or people that we're supporting, et cetera, et cetera. So I wanted to go into leadership development and learning and development and coaching because I felt like the approach to really holding people accountable as leaders, help going on a journey of exploration and help people, new leaders, explore what kind of leader they want to be, recognizing when you are a leader, even if you don't necessarily have the title and you have the opportunity to really drive real good impact in other people's lives. I just get great joy in being able to help people explore what that looks like for them and to align on, what kind of leader do you want to be and how does that look in the real world, right? We can read leadership books and take a little bit of this and a little bit of that. But at the end of the day, your leadership style is uniquely yours. And I think it's important because good leaders drive employee engagement. They and drive innovation because they give people space to fail and space to be creative. Good leaders are great coaches because they hold up the mirror and say, "Hey, what do you see?" Right?
Mhm.
And they're basically asking folks to talk through and really engage in who they think they can become. And I just I find it fascinating. I love it. I get great joy in seeing where those aha moments, those light bulbs go off, and folks are like, "Oh, I didn't think about it that way. I'm going to try this on next time." Or, as they're putting their leadership puzzle together of who they want to be or who they are, and they can change it. We always talk about shifts and growth. Leadership to me is one of those key areas that it can make or break your career journey and in your life. It's good to have good folks who have sound approaches to their work, who can advise and counsel and guide you on your journey. I would say I live in Atlanta. I don't go anywhere without a GPS, even if I think I know the direction. Right? That's what good leaders do. They serve as a GPS.
Oh, I love that. And I love those aha moments. Those are pretty special, aren't they?
Oh gosh, yes.
Yeah,
It's
yeah.
like what? I mean, for me, it was one of those moments where I was just like, wait, what? People see me that way for real?
Yeah,
It's
right.
like I didn't even see myself that way. But when you sit in that and you think about it, I think it was because I approached all relationships and all of those engagements with intention. And
Mhm.
people knew that I'm going to be intentional, I'm going to be genuine and authentic in every interaction. And if you don't feel that, then I'm not being me. And so that's, I think that's the part of the secret sauce that makes me who I am. And I get great joy in helping people uncover their own secret sauce, right?
Yeah,
So
yeah,
lots of fun.
yeah. I love that, and I want to step in that a little deeper too, because again, doing my research, you often talk about helping people discover possible. So, when you work with executives or emerging leaders, what are the most common barriers that prevent people from reaching that next level of growth?
Oh gosh, Tom. I think the number one thing is two things I would say. One is a fixed mindset, right? A mindset that says we did it, we do it like this is how we do it, we've been successful, and we're not going to change it. The other is fear, right? What is it? False evidence appearing real. It is going, we aren't going to use AI because we're scared, or we're not going to explore this line of research because we don't think it'll be profitable. Some people might say that, right? But those are the things that hold leaders back and hold mentors back. Because if you're leading others, the approach that says that people are in a box and this is it, this is who they are, this is all they can achieve, that's limiting humanity. I mean, if you look at the throughout the course of humanity, the people that grow, the people that innovate. You look at civilizations, people that were able to do things, create fire with sticks, like whoever thought, or create masterpieces of art and architectural wonders without machinery, or modern day machinery. Those are the sort of foundational aspects of being a good leader or mentor is having a growth mindset. And a lot of times, if you can't get past your own self, it's a barrier. If you can't sort of see that something else, two things can be true, or multiple things can be true, or multiple things can be possible. If that's not the mindset, then that's a rate limiting step. I mean, as a leader and a mentor, if you're not going to approach those relationships and those roles with us, in a way that says growth is possible or that learning is possible, then it definitely is going to hold you back.
Mhm.
Mhm.
Yeah, that's really helpful. And Stephanie, resilience seems to be a common thread in both your personal journey and your coaching work. So, to help our gurus out there, what lessons about resilience have shaped your approach to leadership and mentoring? Can you help us out with that?
Yes, that's a great question. I think the one of the first lessons I learned for myself is it's okay to have the emotion and show the emotion, right? Essentially, it's okay to be human. Um, it's okay to be vulnerable. It's okay to share when you failed, or it's okay when you've had an accident. Like for me, it's falls. It's not being able to untie knots or do buttons, or losing muscle strength. So lifting things is very tough for me. So it's okay to feel that and feel like, wow, I can't do these things, right? But resilience says that even in the face of feeling a challenge or a setback, understanding and sitting with the emotion, acknowledging it, and then moving forward with an intention to say, and a yes and approach. Yes, I'm feeling this way, and I can do hard things. I can do hard things because why do I know I can do them? Because I've done them before. So oftentimes, the frame of reference for us is our frame of reference. And I
Mhm.
think that as leaders and as folks in the healthcare industry, it's important to just think about resilience in a way that says, what is the opportunity cost? What happens if I'm not resilient? What happens if I don't engage in a growth journey? And answering that question, there's tons of things that I can think of, but for me, resilience is key. It really, as I reflect from the time of symptom onset to today, that growth, that building of resilience, that ability to not just push through, right? Because pushing through, that's perseverance. That's different.
Mhm.
Resilience is you have a challenge, you have a setback. Now you're going to acknowledge it. You're going to sit with that emotion. You're going to be vulnerable. You're going to be okay talking about it. And then you're going to remember that you still can do hard things and that you can take all of that emotion, all of those feelings, and you can channel that into positivity and moving forward. So resilience for me has been, among other, probably a handful of things that I lean on. It is one of the core central qualities or elements of my life right now,
Mhm.
because there are many, many times, almost daily, that I find myself going, "You can do this. Do it. You've done it before."
Yeah,
Or try again, right? And that just gives you a different mindset. The
yeah.
mindset is everything. So,
Yeah, yeah, I love that. And then Stephanie, for our gurus out there, we've got a lot of leaders that are building teams in the healthcare industry, especially in areas as complex as rare disease. What qualities do you believe are essential for building teams grounded in connection, collaboration, and trust?
oh, qualities of leaders. So I think transparency
Hmm.
is key, is one of those big ones. I think, doing what you say, accountability. holding yourself accountable as well as your teams. I think folks that are willing to give and receive feedback, um, because that just connotes that you are higher order thinker. You're focused on the growth part of it, and not necessarily, oh my God, someone gave me bad feedback, right? It's more about what can I learn from this feedback. I think developing skills that help build trustworthiness, because a lot of times people say, well, I trust you, but in order to have trust, you have to be trustworthy. And you demonstrate trustworthiness through your commitment to the folks that you serve, through the dedication to those communities. When I'm building teams, I'm looking for the connection that I can make with those folks to understand like what inspires them. Sometimes when I'm coaching, young professionals, I ask them because a lot of times, people are on the title chasing track, right? And so I said, well, what would you do for free? Like, let's just say you have all the money in the world, you don't really need to work. What would you do? And so that's where we start, because I think helping people lean into their passion, being curious and inquisitive as a leader, those are all the things that help you build that connectedness and that collaboration and that trust of teams. Because you're saying, I'm investing in you, I believe in you, and I'm here to help you grow. And so positive intention is also the probably, assume positive intent. As a leader, making sure that your actions match your words match your actions is super important, because that's again how you demonstrate that you're trustworthy. And trust, I've done a lot of leadership trainings, talks, coaching. Trust is at the heart of it all. And you have to have trust in order for those relationships to thrive and grow. So those are just some of the things that I think of when I think about qualities that help leaders build strong teams, and qualities and people that are engaging in strong, productive, impactful teams. Those are some of the things that come to mind.
Oh, that's fantastic. So, Stephanie, I'd like to first of all acknowledge and thank you for all the insights that you brought us as our guru today. If somebody wants to learn more about you and your consulting services and team building activities, how do we do that? Is there a website or in LinkedIn? How do we learn more?
Yeah. Yeah, so you can find me at hunterbconsulting.com. There's a button to book a discovery call. Those are 15-minute calls where we could just chat about whatever it is you're interested in learning. Or connect with me and follow me on LinkedIn. I'm on LinkedIn as Stephanie Hunter-Banks.
Oh, that's fantastic. So, Stephanie, once again, I really enjoyed our conversation. Thank you for all the insights that you brought to us as our guru today.
Thank you, Tom. Thanks so much for the invitation. I was thrilled to be here, and it was such a pleasure. Thank you. Thank you.
Thank you. Thank you for listening to MedTech Gurus. I am Sylvester Harris, your MC. If you want to learn more about Tom and his consulting services, you can go to www.pctmedical.com or email Tom at tom@pctmedical.com. Now, I can be reached at Sylvester Harris, that's SylvesterHarris 5048@gmail.com, and I'd be pleased to discuss any voiceover work that you may want for your company or broadcast. Hey, thanks so much for listening, and catch us on the next episode of MedTech Gurus.